periumbilical approach to breast augmentation surgery definitely has its advocates, but the vast majority of plastic surgeons prefer other surgical approaches. Surgeons who prefer the periumbilical approach state that the procedure has far less scarring associated with it. They state that the periumbilical incision is almost imperceptible, and this represents the major advantage of this approach. They acknowledge that the procedure has a steep learning curve and that there's a higher incidence of malposition with this type of procedure. There's no question that patients can have an excellent result when this surgical approach is utilized. The vast majority of surgeons prefer other surgical approaches. They prefer the transaxillary approach, the periareolar approach, and the inframammary approach. They feel that these approaches are also associated with minimal scarring, but they also believe that the incidence of implant malposition when these approaches are utilized is far less than with the periumbilical approach. In fact, they feel that the probability of having implant malposition with the periumbilical approach is far less than adverse scarring with the other surgical approaches. It's very important that surgeons be comfortable with the surgical approach that they utilize. Most surgeons favor a type of approach that they're comfortable with because they feel that it gives them better results. Although the results can be excellent when the trans-umbilical approach is utilized, there's probably a reason why the vast majority of surgeons prefer to use other surgical approaches.